This past ASCO session, I had the opportunity to serve as a discussant for 3 of the oral abstracts focused on myeloid diseases. So the first abstract, 7003, focused on a novel agent called Luspatercept, which is FDA approved for use in lower risk MDS with anemia in patients with ringed sideroblasts or an SF3B1 mutation. The second abstract, 7004, was investigating the use of imetelstat, which is a telomerase inhibitor. And this was in lower risk MDS with significant anemia as well, a slightly different population, which I'll get into a little later on. And the last and final abstract I had a chance to discuss was abstract 7005. Which was looking at a novel natural killer cell engager targeting CD123, and the analysis that was presented at ASCO focused specifically on patients with AML that were treated using this novel product. The first abstract, 7003, was the COMMANDS trial presented by Dr. Garcia-Manero. And really what was being looked at here is Luspatercept, which was the investigational agent, or to receive Epo-alpha, which is an erythropoiesis stimulating agent, or ESA for short. Approximately 300 patients were analyzed, and really what the endpoint that was looked at was achievement of what we call RBC transfusion independence, meaning not needing transfusions, and the time specified was at least 12 weeks. In addition, patients needed to have an increase of their hemoglobin by at least 1.5 grams per deciliter. So achieving both of those outcomes, it was defined as meeting the primary endpoint. And on analysis, what was found was that the primary endpoint was met in 59% of patients treated with Luspatercept versus 31% of patients treated with ESA, which met the threshold for statistical significance and established the superiority of Luspatercept in this study, the COMMAND study. I think where things get a bit more interesting is if you look at the specific subgroup analyses that were done. So Luspatercept, its initial kind of investigation in MDS in a phase 3 setting came from the Medalist study, which really focused in on a subset of patients with lower risk MDS and anemia, specifically those patients with increased ring sideroblasts. And what was found was that patients with SF3B1 mutations also were more likely to have a robust response to Luspatercept. And when you look at these subgroup analyses that were done, you kind of see that bear out in what was presented. So in ring sideroblast positive patients, for example, 65% of the Luspatercept arm achieved the endpoint versus 26% in the Epo-alpha arm. In the SF3B1 mutated subgroup, 70% of patients treated with Luspatercept met the endpoint versus 31% with Epo-alpha. I think what particularly stood out to me in the subgroup analysis is if you look at the ringed sideroblast-negative subgroup, the primary endpoint was achieved in 41% of the Luspatercept arm versus 46% of the Epo-alpha arm. And while this was not considered statistically significant, it does kind of make me think whether there's some clinical equipoise to whether we should be using Luspatercept versus Epo-alpha in that subgroup specifically. However, when you take the study results on whole, this study does demonstrate that the use of Luspatercept in lower risk MDS with an EPO level of less than 500 that have not been previously treated with ESAs, that Luspatercept should be considered as a first-line agent in that patient population based on the results of the COMMAND study. One other caveat to note is that this study did exclude patients who met criteria for deletion 5q syndrome, which we really think of as its own kind of entity in terms of how we treat it with MDS, given the exquisite effectiveness of lenalidomide for this population.